And good evening, everyone. As the organizers of the webinar have said, my name is Shamsudeen Maaruf, and I'm happy to be here today to share with you one of the concerns of our health status today in the world. And particularly today, I'll be speaking on the role of nanoparticles in eradicating antimicrobial resistance. So just some house rules. Um, firstly, disclaimer, whatever I'll be saying today here, actually my word, and based on what literatures have said. And in addition, just a bit of house rule. I hope that everyone will be muted as we go ahead, as that will help us to kind of have a attentive house throughout the presentation. So yeah, I think I'll just go into the main deal of today. So as you all know that antibiotics, antimicrobials, kind of substance that are used for therapeutic activities just to kind of prevent growth or even killing them pathogens which are related to maybe infection or even diseases. So, but however, in recent times, we have witnessed a concerning menace, which is antimicrobial resistance. So, firstly, though I will be maybe I will assume that most of us here understand what antimicrobial resistance is, but for the sake of some that might not be aware, I'll just briefly brush on that. The term resistance to bacteria is defined as maybe like as bacteria that are not inhibited or by maybe like usually achievable systematic concentration of an agent with a normal dosage schedule and or fall in the minimum inhibitory concentration. So antimicrobial resistance have recently, like I said earlier, that it has become an issue where we have witnessed maybe where people take antibiotic just to get treated. However, that therapy is not working due to those pathogens have been able to kind of acquire some strategy to kind of inhibit the effect of those antibiotics or even the antimicrobial. And this particular AMR, well, like I said earlier, that it has its own significant effect in terms of healthcare. And AMR can actually be acquired, and also it can be in form of natural way. Like in natural, it can be in form of mutation, where the pathogen itself uh, uh, get more in terms of their genetic arrangement, whereby they acquire some resistance to the particular antimicrobial, or even it can be acquired maybe through conjugation, transformation, transduction in different way, just for it to be able to kind of subdue the effect of the antimicrobial. So there are various factors contributing to the rise of this AMR also, aside the pathogen itself, like being able to acquire resistance to the antimicrobial, such as the use of antibiotics, misuse, and also so on. And one of the additional thing is that maybe like in terms of poor infection control, these are also some of the factors that actually contribute to the rise of AMR. And in all of these, AMR have its own impact on public health, such as mortality rate and also even in healthcare costs. So for the purpose of today, one interesting thing that, because there have been quite effort in trying to see how we can actually tackle this AMR, and that is where what we call nanoparticles comes in. So nanoparticles are actually just some, from the word nano, based on their size, they are just like in nanometers from 1 to 100 nanometers in size. And one of the thing about these nanoparticles is that they have a unique properties. Like I said, their size, they are small. In terms, they are like the range between them in nanometers size, and they also have special surface area, which kind of enable, which kind of give them these unique properties, such as where we know that some of these nanoparticles have the ability to, like, they have a distinctive adsorbent surface area. They have a special solubility, which are also very important for antimicrobial effect within our system. And also these nanoparticles exist in various types. There are various types of nanoparticles. We have some of them are metallic, such as quantum dot. Some of them are even polymeric, like they are formed from polymers, like the polymeric nanoparticles, even dendrimers. And also we also have some of them that are lipid based, like they are formed from things like cholesterol or even phospholipid. And in addition, one of the things about nanoparticles is that it has been utilized for various applications, like in terms of medicine, where like in previous research, these nanoparticles have been used in terms of anti-neoplastic, like in cancer treatment, and also even in environmental remediation, like water treatment and so on and so forth. So what actually is the threat and what is the concern here about AMR? So one of the challenges related to antimicrobial resistance is that there are limited treatment options, because even in recent time we have witnessed that there is no much effort being done in terms of maybe like coming up with new antibiotics or even new antimicrobials. And this is not due to maybe lack of research. Rather, these are related to maybe maybe like they are related to like lack of or limited collaborative effort in trying to kind of come up with new antimicrobials that can be effective. And most importantly, also we have seen spread of resistant strain of a lot of these pathogens. So these are some of the challenges that are related to AMR. And one of the things also is that in terms of antibiotic, we are, according to the WHO, they said that there is a time, like there's an era where we will see what we call a post-antibiotic era, where mostly all these antibiotics or even all these antimicrobials maybe have stopped being effective against their function, in terms of their function. So these are some of the challenges. And so what are the possible innovative solution? And that's where we have seen various strategies being explored, like in terms of bacteriophage, which is a viral that have the ability to attack bacteria. We also have things like gene therapy, where gene have been kind of modified in terms of just to improve maybe the effect of maybe particular antimicrobial, or even to address antimicrobial resistance. And also we have things like immunomodulation, where the system or the host cells are kind of modified in terms of their immune function, just to fight a particular pathogen within the system. And for the purpose of the talk today, which is also, we also have possible solution, which is using the nanoparticles based approach, just to see how we can address antimicrobial resistance. But as shared earlier, these nanoparticles are promising in terms of combating antimicrobial resistance. And one of the things that make them promise is that they can actually bypass resistance mechanism, which this pathogen have acquired. And these nanoparticles, sometimes they can serve as maybe like as carrier, maybe like or even what we call nanocarrier or even nanocargos, just for delivery of therapeutic agents like drug, vaccine, or even immunomodulatory compound, that IMCs, within our system. So as you can see on the diagram illustrated here, you notice that, like I said earlier, that these nanoparticles can be used for various functions in terms of therapeutic purpose. And here they can be used like in terms of delivery of antimicrobial protein or peptide. They can be used for delivery of things like CRISPR, or even silencing inducible RNA, which can be used for like modifying the gene within our system, or even for delivery of things like antibody, or even the antibiotics, or even the antimicrobial. So these are one of the unique thing related to these nanoparticles. And an example of such nanoparticles is things like silver nanoparticles, liposomal and antibiotics. So as we go further, I'll share with you how actually these nanoparticles work, and how possible, maybe like how can they be actually be used in addressing the antimicrobial resistance. So yeah, like I said, in terms of the mechanism of actions, or how possible can these nanoparticles be used to address AMR? Firstly, these nanoparticles actually interact directly with the microbes. Like they can cause destruction of the bacterial membranes, which at the end will lead to the death of that pathogen, or even inhibit some virulent factors related to pathogen, like the biofilm formation, which is so important for some bacteria and so on. And in addition, some of these nanoparticles also interact directly with the host or the host cells in terms of the physiology of the host cells, by kind of modulating the immune function or even the inflammatory functions of these host cells. So specifically, there are various ways by which these nanoparticles can kind of address or even fight AMR. So the first one is in terms of oxidative stress role. So these nanoparticles, because they come in different forms, like I said earlier, they interact directly with the pathogen, whereby some of them, depending on the type of nanoparticle that is used, if it is maybe a functionalized, maybe like a nanoparticle that is carrying an antibiotics, that is maybe like a nanoparticle that has been coated with antimicrobial, they can be used to kind of deliver certain antibiotic into the system, or even the nanoparticles itself can be used as actually the active antimicrobial agent. So first, like I said earlier, that one of the way by which these nanoparticles work is by what we call oxidative stress, whereby these nanoparticles kind of causes oxidative stress within the host cell, which can actually cause the pathogen cell by either DNA damage, or even the destruction of the cell wall, the plasmid damage, or even destruction of some enzymes that are very essential for the pathogen survival. And in addition, even in terms of interrupting the electron transport chain within the pathogen. So an example, just to give an example of how this nanoparticle, like one of the nanoparticles that work in this way, is we have things like magnesium or even calcium nanoparticles, which actually generate some superoxide radicals, or even zinc oxide. So these nanoparticles, after maybe like getting into the pathogen, they are able to kind of generate what we call hydroxyl radicals, and even things like hydrogen peroxide, which are reactive oxygen species, which can causes oxidative stress within the pathogen, and at the end lead to the pathogen death within the system. So these are one of the way by which these nanoparticles work within the system. And another example or mechanism by which these nanoparticles work is by what we call metal ion release role. In this case, metallic-based nanoparticles release metal ions that can actually interact with the functional groups of the bacterial cell membrane, such as the carboxyl or even amino, and even things like mercaptor groups of the cell membrane. So the interaction of these metal ions with the cell membrane of this pathogen kind of lead to maybe like things like cell membrane damage, or even the destruction of some essential organelles within the system, like plasmid damage, DNA damage, or even cause some distortion of the structure of the pathogen itself. So this is another way by which these nanoparticles work to add kind of fight antimicrobial within the system. And lastly, another way by which these nanoparticles work is what we call the non-oxidative role. And in this case, it's not more like, it's not related to the oxidative role, but in this case, these nanoparticles work in a way whereby they penetrate the microbial cell wall, maybe like interacting with the bacterial lipopolysaccharide or even phospholipid defense barrier, which at the end they cause a porous or should they kind of cause pores on the cell membrane or even the cell wall of the bacteria, which at the end causes some instability in terms of proton gradient within the cell membrane, or even the dissipation of the protons within the system. And this particular mechanism also have, like, in terms of the effect, it can cause some interruption of the electron transport. It can cause the destruction of the enzyme activity. It can cause the cytoplasmic release, like causes damage in terms of the cell membrane, which kind of lead to cytoplasmic release. It can also cause some plasmic damage, DNA damage, and even destruction of the cell wall, as stated earlier. By this way, these nanoparticles are able to kind of address or kind of bypass the resistance mechanism that is associated with some pathogen. Though some research have said that it is essential to actually understand the mechanism of these nanoparticles to be able to design an effective nanoparticles. This is because research have also kind of shown that indeed that some of these nanoparticles are prone to like resistance itself. Though one would now start wondering, should we now start being concerned about nanoparticles also getting resistance by the pathogen? Because some things like silver nanoparticles or even magnesium have been shown in some literature that they indeed can actually be resisted by some nanoparticles, especially when we talk about the mechanism of some of these nanoparticles in terms of the metal ion release. So these are some of also the concerns to put in mind. However, like we say that these nanoparticles can be used for various functions. They can be used like for in terms of like delivery of some therapeutic agents, like when we look at the mechanism or even the antibiotic resistance or antimicrobial resistance itself, is that this pathogen resist that's the key. Maybe like the pathogen is not allowing the antibiotic to get into the system. But these nanoparticles, if used as maybe, let's say, for instance, a nano carrier, they are able to kind of bypass the cell membrane and get into the system. So these are some of the ways by which actually these nanoparticles itself can contribute to fighting the antimicrobial resistance within the system. So, and one of the, just to share some stories in terms of nanoparticle-based treatment, as we all know that probably that in terms of cancer, that various antineoplastic have been used, which some example of them is things like zero valent metal or even metal oxide, which have shown promise in terms of antineoplastic activities. Like some of these nanoparticles have been used to kind of deliver effective antibiotic agents or even vaccines just to address cancer. And in terms of some bacterial diseases also, such as tuberculosis, which is actually a work which I'm doing. We also use things like what we call lipopolymeric nanoparticles, which is more like a polymer-based nanoparticles, which have a lipid bilayer. And one of the things about these nanoparticles in our work is that we kind of use this nanoparticle because it just like it mimic the bacteria itself, and that gives the nanoparticles that advantage to be able to get into the system of either the host cell or even either to get into the pathogen itself. These are one of the things that these nanoparticles can be designed to do within our system. And like I said earlier, that these nanoparticles can also be used in terms of environmental remedial, because when we look at AMR itself, it's not just about the medical aspects that is like that is the cause of AMR within our community. Like even the environment also have its own shade in terms of the development of AMR. Like if like in terms of wastewater, it also have its own contributing factor to AMR. So these nanoparticles can also be used to kind of do maybe like just like water treatment. Like an example of such nanoparticles is the zero valent metal nanoparticles, which can actually be used to kind of induce changes in terms of reactions between some maybe like pathogens or even some toxic substances within the wastewater. This is one of the things that these nanoparticles can also be used for. And it will also be interesting to tell you that some of the vaccine that some of you have obtained, especially in terms of COVID-19, actually contained these nanoparticles. Especially when we look at the likes of the Johnson vaccine, some of them actually have these nanoparticles. Like the vaccine itself, which is the messenger RNA vaccine, is delivered into the system using these nanoparticles. So some of you shouldn't be surprised that actually you already have these nanoparticles within your system, and that shows that indeed that these nanoparticles are effective and have been proven to be used. An example is the things like ONTAC, which has been used like in terms of anti-neoplastic. We also have Zanaflex, which is more related to Moxus relapse. We also have Ement, which is also a brand anti-neoplastic, anti-vomit agent. We also have Rebenin, which is also, I think Rebenin is mostly used for anti-hemophilia in terms of addressing bleeding. And we also have things like Martivo or even Doxil, which are both anti-neoplastic agents. So, like I said, you observe that mostly I've been highlighting the case like success stories of this nanoparticle in terms of cancer treatment. This is because mostly research have shown that like we have a lot of research being done in terms of using nanoparticles to address cancer. But much recently, we are now seeing nanoparticles being explored to kind of address things related to microbials, just to be able to address AMR. And just like I've shared with you, like in my research, what I'm currently doing is to explore on what we call lipopolymeric nanoparticles. Though for my own research, we are not majorly targeting the pathogen in itself. The nanoparticles we are using is a functionalized nanoparticles, which is functional to kind of modify the host cells. Whereby in this case, what I meant is that by the time the nanoparticles get into the host cells, it modifies the physiology of the host cell, whereby it becomes toxic for the mycobacterial tuberculosis to be able to survive within the system. And that way, we are able to kind of say that we are on the way of achieving antimicrobial resistance in relation to mycobacterium tuberculosis. And an interesting thing to also mention is that these nanoparticles can also cross the blood-brain barrier, which is also one of essential things in terms of therapy, because one of the challenge of therapy is that, especially when we talk about like things like pneumonia or even meningitis, some of these nanoparticles are like, I mean, some of the antibiotic don't have the ability to cross like the blood-brain barrier, and that limits their function also. But one of the promising things about these nanoparticles is that they are able to kind of cross that barrier and get into the maybe like the neurological system and be able to contribute to fighting any sort of pathogen that are uh, related to maybe like any neurological systems. So yeah, then one thing to also mention, like earlier I did mention that there are also some concerns that are related to these nanoparticles, like in terms of safety. That is aside when I mentioned that some research showing that these nanoparticles can also be resisted by the pathogen itself. However, there are different way by which we can also like in terms of long term to address that, which is like I mentioned, we can use things like antimicrobial peptide just to kind of deliver essential therapeutic agent within the system. So another safety concern related to the nanoparticles, which have actually limited the success stories in terms of antimicrobial effort, is in terms of the toxicity or even the environmental impact of these nanoparticles. Because the FDA, which are responsible for approving and approving some therapeutics agents, Actually, because of the like because of some literature showing that some of these nanoparticles actually have their toxic impact within our system. These have actually eliminated the use of these nanoparticles. However, like shown that there is still some of these nanoparticles that are being used in terms of like other disease cases, just to address just to address some particular diseases. We still believe that these nanoparticles can be used for other pathogenic therapeutic reasons. But for us to be able to address this, we need to do things like dose optimizations or even biocompatibility testing within the system, just to be able to understand how indeed these nanoparticles work, and how indeed we can use them to address antimicrobial resistance, or even microbial pathogen within our system. Though one thing to also mention is that aside the toxicity, one of the most effective technique is the capping of these nanoparticles using what we call biopolymers. These are some of the way by which these nanoparticles, in terms of like addressing their toxicity, these nanoparticles can be kind of cap or kind of coated with what we call biopolymer, which kind of limit the toxicity of these nanoparticles. And with this, I believe that we are on that stage where these nanoparticles can be used with much like lesser concern in terms of their toxicity, in terms of their environmental impact, which I believe that will be there soon we'll be able to use these nanoparticles with full confidence without concern about toxicity. And for future perspective, these nanoparticles can also, like currently based on what I have shared, that they can be used in terms of targeted delivery system, where I did share with you that these nanoparticles can be used to kind of address or like target particular pathogen, or even they can be used for combination therapy, where you can use different sort of nanoparticles, which even kind of help us to be able to address any potential resistance to these nanoparticles. We also believe that combination therapy could help, is maybe by either delivery of the antibiotic itself, or even by targeting the pathogen, or even like modulating the host cells within the system. And potentially, these nanoparticles can also be used for personalized medicine, or even for prophylactic reasons. So these are some of the perspective related to nanoparticles in terms of the antimicrobial resistance. So for collaborative efforts, we cannot actually address AMR by just looking at all these noble innovations, like the bacteriophage, by maybe like the gene therapy. There are a lot of effort that need to be put into ground, like to address indeed AMR. Which in this case I would say the One Health, like by bringing together scientists, clinicians, engineers, and even policymakers. We this All these people, like all these stakeholders, need to be like involved in terms of addressing AMR, even in terms of the use of nanoparticles, because some of these nanoparticles can actually produced by some of these engineers, like chemical engineers, and some of upon production, the nanoparticles have to be tested in vitro, in vivo, to understand their biocompatibility or even their toxicity. And in terms of policy, also like I've said, also that the FDA also have their own shared responsibility in terms of in terms of the guidelines related to these nanoparticles. So for us to actually address this AMR, exploring on nanoparticles, it have to be like indeed like a collaborative effort, maybe like public private partnership, or even build like research consortiums, which kind of encourage or even enhance translational scientific research. So by that, I believe that with that we'll be able to kind of address AMR, potentially exploring the nanoparticles within our health system. And one thing to also mention is that, which we'll just say is more like, which I'm rounding up, is that AMR can actually, it can be stopped yet, but can be slowed down, reduced, and managed. Because the reality of things is that, as this menace rises, it's not something that can be stopped at once, because the pathogen are indeed uh, 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 um, uh, uh, like acquiring different resistant mechanism. So it's not something that can actually be stopped, even maybe by gene therapy, even by maybe the nanoparticles. However, we believe that this innovative approach or solutions like the nanoparticles can only slow down or even reduce or manage this antimicrobial resistance. And lastly, I believe that, based on what I've shared earlier, that these nanoparticles could pave way for us to be able to address some antimicrobial resistance. And with this, I will say that, yeah, that's all from my side. But I hope I'm able to convince you about the potentials of nanoparticles in addressing AMR. And yeah, with this, I say that thank you for listening. If you would like to reach out, these are my social media pages. And anytime I'm happy to connect. So if there's any question, yeah, I think, yeah, the room is open. Thank you.
Okay, thank you very, very much. It's a pleasure to have you with us once again. And I'm sure like that everyone on this call, like myself, must have understood the impact of nanoparticles and how it could be used to combat the menace of antimicrobial resistance. And thank you very much once again for emphasizing the importance of One Health and how it's just like a public health issue. One Health is needed to curb this ongoing threat. So at this point in time, I'm sure we all have noted the points down and we all have some gray areas that we will seek clarifications for. Please, if you have any question for our speaker here today, you can use the hands button, raise up your hand, then I call you on to speak. Thank you very much. So I think individuals are still thinking on the questions they're going to ask. I think I have a question for our speaker here. Thank you very much once again. I'm very, very delighted to have you on this call. And we as a team, as a group, is delighted to have you once again on this call. I want to have a concern of mine that when we had the first antibiotic being developed and it was a wide success and it kind of stopped this common deaths from wound and likes like that. And just immediately when the celebration of that um, occurred, we recorded the resistance, right, of the first drugs and antibiotics that was being developed then. And moving down to the recent times, almost every developed antibiotics has develop resistance to one or more strains of bacteria or microbes in general. So, do you see a future of these promising nanoparticles becoming like antibacterial or antimicrobials in general in recent times? Thank you very much.
Thank you for that question. Though I didn't get the last statement or phrase you made, do you mind phrasing?
Okay. So my question is, we noticed that before then, when penicillin was discovered, it was a wide success. It kind of stopped the prevention of death and the likes like that. And now in this era, we've noticed that almost every possible antibiotics or antimicrobial we know in general has microbes have developed resistance to these antibiotics, right? And you know that antibiotics, almost all available antibiotics today have one or two strains of microbes that are resistant to them, right? So my question now is that I know that the idea of nanoparticles is still promising. It's still a welcoming idea. It's a welcoming innovation, like the way we had for penicillin then. Do you feel like there will be a future that if the same practices of the way individual use antibiotics still continues, we might have come an era where almost all available nanoparticles will have developed resistance, something like that.
I think I got the question now. I think during the trend or the course of the presentation, I did share that one of the concern is that some of these nanoparticles have shown that they can actually be resisted by the pathogen, like in terms of things like silver nanoparticles, because some pathogens have been shown like they can be able to resist the metallic ion release within the system. However, in terms of like when we compare with how like in terms of post antibiotic resistance, we believe that like I said, we can't actually stop this AMR. However, we can't fully say that we foresee an era where all these pathogens will be able to resist nanoparticles, because when we look at the nanoparticles itself, there are various like they have like unique properties. Like some of them are organic in nature, inorganic, or even some of them contain a hybrid of both organic and also inorganic materials. And this nanoparticle can be used maybe like in terms of combined therapy. So we believe that even if there will be an era where I maybe like scared of having like nanoparticles resistance. We believe that with the promise of using the combination therapy approach to address maybe like disease cases, we will be able to kind of resolve the concern related to the use, related to the development of resistance against these nanoparticles. So I believe that that era potentially we wouldn't see such era since this nanoparticle can be used for various function like the nano, maybe like to deliver antibiotics or even deliver vaccines. So I don't see that era coming up yet. It might, but like I said, we have seen the pathogen actually resisting some of this pathogen, but yeah, I don't potentially, if I'm to share with the public in terms of my own perspective, I don't see that era like like maybe like a post nanoparticles era where the nanoparticles are no longer effective or are resisted by this pathogen. Yeah.
Okay, thank you very, very much, sir, for your question. For the answer you give to the question, and I am very, very grateful that took your time to explain it to every one of us on this call. And for me, I think I understood how the play comes in and how it's actually very different from antibiotics and antimicrobials in general. Thank you very much once again for explaining that. Do you have anybody on this call that have questions for our speakers? Please, if you have any, you can either use the chat box or you raise up your hand to ask the question. Thank you. Okay, we have a hand up. Please, Nasu, if you are there, you can only
Thank you very much. Good afternoon or good evening, everyone. Can you all hear me, please?
Yes, I can.
Yes, I can. Thank you very much. Well, mine is not actually a question. I think it's just a way of appreciating the presenter for today. I believe you have delivered well, and I believe you me, we are learning. At the same time, we want to, or let me say, I want to appreciate the organizers of this program to keep doing it. I know that people are not for joining or forthcoming, but believe you me, don't be discouraged. Let's continue to do it, and inshallah, one day we will uncover a very huge success. So thank you very much, the organizers, the presenter. Thank you for the time. Thank you for the opportunity. We really appreciate it. Thank you very much once again.
Thank you very, very much, sir, for the encouragement, and we are very, very grateful for your time. Also for coming on to enjoy and listen to this wonderful presentation, and to everyone on this call too. We are also grateful for your time and for you choosing to be a change maker, preventing the menace of antimicrobial resistance, and also contributing to the efficacy of public health and environment. Thank you once again. We have another hand by Gloria. Gloria, if you are available to speak, you can unmute and speak. Thank you.
Okay, thank you very much, our presenter. Thank you very much for that insightful presentation. And thank you very much for all the organizers that even we are coming up to learn about the nanoparticles. I'd never heard of nanoparticles, but at first I thought the nanoparticles are toxic. So, but the presenter explained very well, was like, since they are toxic, they coat them with some material he talked about, like to reduce so that they don't allow the toxicity to come up. But now my question was, though that substance they use to coat the nanoparticles, because mostly we respond differently to different things, so how are they going to do it so that people are not affected, because we respond differently? How are they going to work upon that issue? Yeah, thank you.
Thank you for that question. I think that's really a nice question. In terms of like how to address I think that even brings me to what we call personalized medicine, which is where everyone, like we all know that every one of us have their own different genetic arrangement, and what we believe that we'll get to that point where depending on the nanoparticles that will be used, these nanoparticles will be designed based on each individual genetic system within our body. And by such strategy, we believe that we'll be able to kind of address any issue like related to like reacting to the nanoparticles differently. We believe that with such way, every individual will be able to kind of have like an effective a therapy that is kind of individualized for everyone. And that's, like I said earlier, that's one of the potentials of these nanoparticles, or even therapy in general. And also, in addition, um, about the toxicity aspect, like I said, that some of us here probably already have that nanoparticles. If I believe a lot of us have the COVID-19 vaccine jab within our system, which, like I told you, these nanoparticles actually, because it's a messenger RNA-based vaccine, some of them uses these nanoparticles to deliver the messenger RNA within our system, and that doesn't show any toxicity. Some of these nanoparticles, like especially an example of the lipopolymeric nanoparticles, is just a typical cholesterol, like phospholipid, that is used to deliver this essential vaccine or drug within our system. So these are things that are actually related, like they are similar to our system. So these are another way by which these nanoparticles can be used to deliver any essential things, and even be able to like address any scale of toxicity within our system. And like I said, there are a lot of nanoparticles, but for us to be able to like achieve effective antimicrobial activity, we need to understand how these nanoparticles works, and that's what researchers are currently doing, to understand how some of these various nanoparticles works, and even to come up with other strategy just to address any scale of things like the toxicity, things like potential of nanoparticles resistance. I hope that answered the question.
Yeah, thank you very much.
Sure.
Thank you very, very much, sir. Thank you very much for answering that question. I think we have no hands raised, and the comment section, the chat box is empty, which signifies we have no other questions from individuals. I see a hand from Nasru. Is it the previously raised hand, or you have another thing to share with us? Okay, I guess it's should be okay.
Yes, please. It's previously raised hand. Thank you. I forgot.
Okay. Okay, thank you very much once again. Thank you very much once again, sir, for coming on this call today. As I am always grateful for your time and for the support you have given to Uduyas. Mr. Shamsudeen have been a mentor of mine, and I've learned a lot from him over years, and it's a pleasure getting to learn from him on antimicrobial resistance and how we could use nanoparticles to curb the menace of tuberculosis and in general microbial in general. So thank you very much once again, everyone. Thank you very much, our speaker. And we are grateful for your time today. and we look forward to having you all with us tomorrow, which is the concluding session of our webinar series, where we will be having two sessions. The first session will be on the impact of youth ourselves to see how we could complement antimicrobial resistance, and the second session will be how we could go into our communities, and I believe we all come from several communities, to see how we could form antimicrobial resistance. So the whole thing was curated in the form of you learning what AMR is, knowing the possible solutions of AMR, and knowing then now we are now going to the facet of knowing your action as youths and how you could go into your communities to solve those problems, which is the last part of the webinar series. So thank you very much once again, and we are very, very grateful for your time. In the absence of no questions, I think we will be drawing the curtain here, and we meet again tomorrow. Thank you very much. If we have a concluding statement from our guest speaker before we close the session for today.
Thank you to the organizers, particularly I appreciate Zakaria, like you said, that we have been having like a mentor-mentee relationship for a while, and I'm happy for what you have been achieved. I mean, happy with what you have achieved and doing in terms of like contributing to this particular menace, which is AMR. And like I said earlier, that we will not be able to address AMR or even slow it down without actually putting all efforts, like in terms of One Health. So I think every one of us have a is a stakeholder in terms of addressing AMR. And lastly, I appreciate the invitation to give a talk on how we can also contribute to addressing the AMR using exploring the nanoparticles. So with this, I say thank you, and I'm looking forward to the next session. Thank you.
Thank you very, very much, sir. Bye bye, everyone. We meet again next week. Tomorrow for the next session. Thank you very much.